All right, everybody, welcome to session 4. Thank you for joining us. So chances are that you've heard us talk about or seen some of the new roundtable materials for introducing HPV vaccine starting at age 9. A growing number of HPV vaccination champions are moving these efforts for, can we call it proactive vaccination? So let's see what position our players take on the topic with the session moderated by Dr. Heather Brandt from St. Jude Children's Research Hospital. Thank you.
Thanks, Kristen. Hi, everyone. So in accordance with recommendations that have been established by the CDC's Advisory Committee on Immunization Practices, providers have been directed to routinely recommend HPV vaccination at age 11 or 12 with Tdap and meningitis vaccines, and also seasonal influenza and now COVID-19 if those are indicated. So updated guidance from the American Academy of Physicians, American Cancer Society, and the HPV Roundtable has encouraged HPV vaccination starting at age 9, just like Kristen said, prior to the other adolescent vaccines. So due to the COVID-19 pandemic, which we've been hearing about, and missed opportunities for HPV vaccination through well child visits, more conversation has emerged on whether it's worth waiting to give all vaccines together or whether starting the HPV vaccine earlier than age 11 should be adapted as the standard approach for HPV vaccination. So let's take a look at our lineup for today. So on our panel, we have Dr. Robert Benarchik from Emory University Rollins School of Public Health, Dr. Margot Savoy with the American Academy of Family Physicians, and Dr. Janet Siddiqui with the Johns Hopkins Community Physicians as well. So we're going to move through a series of questions to get input from our panel of experts, this all-star lineup, to see if they can help us come to a decision about our best approach. So I'm going to start with a question that's for all three of you. What are some of the reasons we are talking about initiating HPV vaccination at age 9? And let's start with you, Margot.
So thank you so much. Thank you for letting me be here to have this conversation. I think one of the easiest reasons to think about is just vaccine burden. So a lot of times parents come in and they have a concern that their kids are being asked to get too many shots at the same time. And even for your practice, it might be a bit hectic trying to deliver that many vaccines at one visit. And so one way to do that is to spread them out a bit. But instead of spreading them out in a way that exposes the child longer and has them able to catch or be exposed to the disease in a longer window of time, you could actually shorten the window for HPV and still be perfectly within the space of that's appropriate for giving that vaccine. And so this idea about moving it, in this case, doesn't actually leave the child any less exposed. It actually just gets them protected sooner. And that, to me, is a benefit and a win.
Thank you. What do you think, Janet? What are some of the reasons we're even talking about initiating HPV vaccination at age 9?
So starting at age 9 has several benefits. We start talking to parents that this is an anti-cancer vaccine, and there's less of a perception associated with sexual activity at age 9, since most children at that age are still prepubertal. You get a better immune response at the younger ages, only one vaccine at that visit instead of 3 at age 11, and it still remains the 2 doses versus 3 in that age group. Parents trust their child's physician, so this is an opportunity to have the conversation. If there's barriers to vaccines such as hesitancy, misinformation from social media, knowledge gaps, this is an opportunity to have some motivational conversations and share the research, because we have the opportunity to prevent cancer that's caused by human papillomavirus.
Thanks. Bob, what would you add? What are some of the reasons we're talking about this?
Yeah, I mean, I think one of the biggest reasons is that, even after, coming up now on past a decade and a half, HPV vaccine coverage rates just keep falling behind, what we're seeing for Tdap vaccine, for meningitis vaccine, for adolescents. And we just need new strategies. And we know that adolescents are going to the doctor. We know they're getting their Tdap shot. We know they're getting their meningitis shot. But we need to really capitalize on every opportunity and make sure that our kids are getting vaccinated at the earliest opportunity. And if we can start HPV at 9, that gives us a lot of opportunities to come in, take advantage of those routine well care visits as kids are coming in, and try to close some of that gap in between HPV and our other adolescent vaccines.
Great. Those are all great reasons for us to really explore in more detail starting at age 9. So Janet, this next question is for you. You already mentioned some of the benefits, so let's dig into those. What are the advantages to initiating HPV vaccination at age 9 for the parents and caregivers who are making those decisions for families? What are the advantages for them?
Well, I think for the parents, it's a better understanding of the vaccine because at 9 years old, there's not a whole lot going on for a healthy 9-year-old. And so it's really an opportunity that you have to really have the conversation with the parent about the HPV vaccine and answer any questions that they have about the vaccine. They're at that age, they're not really thinking about, middle school and their, sexuality of their teenagers. So it's a good opportunity to really have the conversation. They may be getting, there's a lot of misinformation out there in social media. They may hear things from their friends. They may need additional research to help them understand the benefits of the vaccine. So we can share that with them and do some motivational conversations. Maybe they're not going to be right on board at that moment, but you keep the door open and you keep having the conversations every time that they come in.
And what about for the patient, for the adolescent? What are the advantages for them as well?
Well, certainly, for the children at 9, it's the 2-dose series, you get a better immune response. When they get closer to, 11, 12, they may have questions of their own. They may have questions about the vaccine being anti-cancer vaccine, and they may, be interested in share the conversation with their parent in terms of making an appropriate decision. And
I always think about at this age group that fewer shots, right? Fewer shots if you tease it out.
Yeah, it's only one shot.
Just one.
Just age 9 or 10 versus, that bundling at age 11 with the other ones.
Right. So this next question, Margot, I want to ask you. So we can acknowledge that providers and health systems spent all this time, effort, and resources, as well as training on a bundled approach to promote these adolescent vaccinations at ages 11 to 12. So for what reasons do you see that providers and healthcare systems may adopt the practice of starting at age 9 for HPV vaccination?
So for me, I think, I'm actually a big fan of the bundle. So, I'd like getting all my stuff at one time. So I'd rather get everything all done at one visit and kind of cross it off the list. And so I could see how for some people, it might be frustrating to have to sort of unbundle part of the bundle. For me, though, when I really sat down and thought about it, so at first I was annoyed. And because I really had put a lot of effort into like building our EMR and getting all of the like order scripts just right. And so now I got to go back and undo that. So I'm not going to lie, like I started off a little bit frustrated. But then when I really started to think about it, I had started talking to parents and families at age 9 anyway, because I was doing a lot of the anticipatory guidance and that sort of pre-counseling, giving people a heads up about what's going to be coming at upcoming visits and letting them know sort of what to look forward to. And so now the only real difference that we're having to put in place is just switching from, and just an FYI, we're going to be doing this vaccine starting at age 11 now turns into, well, we can go ahead and do this one today. We just get it out of the way. And then we'll do one this year and one next year. And then 11, you'll get, 2 more. And then in the meantime, we'll still do your flu shot every year. And it sounds like we're going to be giving you COVID boosters every year. And that's okay. Like we'll just sort of space it out and work our way through. And so I'm not sure that it really changes the whole message. And to be fair, honestly, the bundle is still a real thing. So that if you happen to make it to age 11 and you haven't yet been vaccinated, I'm still going to need you to use that bundled approach and try to get all 3 vaccines in. And so you don't have to throw out the baby with the bathwater in this case. You can use both but what you're trying to do is get in as many opportunities as possible. So it does mean some work on your part, sort of turn off some of those reminders, or make them so that they fit this sort of 9 to 12 as opposed to just 11 to 12 age range. But they're pretty simple fixes. And they don't have to be hardcore reminders in the sense that you failed if you didn't get it by 11, but you certainly could put in things that remind you that they're 9 or that they're going to be 9 and help that conversation happen a little differently. And so I don't know that it has to be as dramatic as it might feel initially when people get over that initial, like, we just finished building the thing. But I do think that there's ways to transition it and make it quite smooth. And it doesn't even have to sound odd as you're describing it to the parent who may have had an older child that you just spent all this time telling them about 11 and 12. And now it sounds like you're shifting your game. And the answer is no. Remember, we started talking about it earlier when your child was when the older child was younger. We just feel like, there's a lot of stuff going on right now. We'd like to get everybody caught up and make sure in the right space. And so we wanted to give it to you early. And we've always been allowed to give it at age 9. This isn't something new. And so just reminding people about some of that background might be really helpful to sort of lower that temperature and help everybody, including the health systems that have to make some changes, feel a little bit better about it.
I really like what you said about, you can start at age 9. We've always been able to start at age 9, but if you get to 11 and you haven't had it, it's still going to be bundled. So your approach that you're currently using still works. It's just in some cases it could be helpful to improve coverage to start a little earlier. So I really like how you phrased that. Janet, I'm going to come to you with this next question. So, Margot just alluded to a few challenges potentially for providers and health systems, but offered a way to work around. But what do you see as some of the concerns about starting HPV vaccination earlier than 11 to 12, and especially maybe right now during our pandemic era?
Oh, sure. I think initially that we thought it would be easier to bundle with the middle school vaccines. And I also think probably healthcare workers thought that parents would not be accepting of HPV at age 9, and they might be too young and would lead to more, and maybe even lead to more hesitancy and lower vaccine rates. But that doesn't seem to be the case since the AAP recommended that age 9 to start at age 9, and it's become more acceptable. And I think that sort of pendulum is swinging in the other direction. As it relates to the pandemic, due to the pandemic, we've all gotten behind on vaccinations in our clinics and well child visits. And now that we're catching up, but we still have shortages with the healthcare workforce, and access to doctor's appointments are also lagging. Parents have been staying away, resulting in healthcare gaps and vaccine delays. We do have to do a lot of outreach to our parents to schedule well visits and actually look at opportunities, at every visit, acute care visits, follow-up visits, to really catch people up on the HPV vaccine due to the pandemic.
Those missed opportunities become even more important now in the face of trying to catch up. That's a great point as well. So this next question is also for Margot and Janet. So you guys have been practicing for a while. You definitely, Margot mentioned, you have built this bundle, built it in the EMR and everything. So tell us more specifically, in addition to what you've already shared, how has your communication evolved and what has your experience been?
So I definitely think there is something to be said for helping, so I'm a family physician, so I take care of people that are across the whole family. So it's not uncommon that I've already started having this conversation with the older kid. And then, the younger kid's now coming in and mom is like, why does your story change? So for me, it's not uncommon for people to just have questions because they've actually been listening to you and sort of taking it in over time. And so I find that being transparent with people is always really helpful, and helping them understand the context and why we're sort of pushing for one thing versus another has always been really helpful. So, the thing that keeps coming up for me is that the data that came out around how much more effective this vaccine is the younger you are versus when you're older. So that for a while I had parents who wanted to wait till they're 16 or wait till they're 18. And like, we've got time. I can wait all the way till 26. And you're like, wait, time out. That's not what we're trying to do here. Like, it turns out it's so much more effective at younger ages that you can actually get more bang for your buck. This is why you only need 2 shots. And it's not just a matter of like, you only need 2 and we're somehow trying to reward you. Your immune system just does such a great job at the younger ages that it's just a great opportunity to get more bang for your buck with less shots. Why wouldn't you want to do that? But what I have found is that it's not always that the parents are hesitant or don't want to get a vaccine. Life happens, and sometimes you just miss visits. There's just a lot of things going on. People's schedules are hectic. I don't think the pandemic made that any better. And this transition is sort of back into real life versus not real life and being more in that pandemic world. It's just been really hard on folks. And so this idea that like, even if you started at 9 and you tripped up and missed a year or two, I'm still well within the range of you getting that best and optimal dose response versus if you wait too late in that window and now you're having trouble. And so I still have time to like catch you up and get you where you need to go and get all the benefit without really any loss. So there's not really a harm or a downside to giving it to you earlier, but there is a downside to waiting too long. And I don't know that we were doing that messaging at the beginning. Like we spent a lot of time talking about just getting it and trying to get it over, some of the concerns and the fears about the safety, that we weren't even getting to talk about all the greatness about like being able to do it at a good time and at a scheduled time and how you could get some bonus. And so I've spent a lot more time talking about that. I've had less parents sort of concerned about some of the things I had come up early in the vaccine. So things around fertility, or there was a weird thing at one point about people walking backwards after they got the vaccine. So I spent a lot of time sort of putting out those fires. Those have gone away. They kind of transferred to COVID vaccine actually. And so now I spend more of my HPV time talking more about why I think it's so important and just this idea that you could prevent cancer. And for many moms who've had experiences with pap smears, the idea that you wouldn't have to have the fear when you get your pap smear done or the pap smear comes back abnormal, or for the moms who've had to experience having colposcopy or going through other procedures, like I've been really surprised at how many people have shared just the idea that you could prevent their child from ever having to have that experience being a really wonderful thing. And if I started it earlier, that means they have even less of a risk. And you're like, yes, because it's skin to skin contact. You don't have to have sex in order to get HPV. It's literally skin to skin contact. And that idea has really, really won people over. So it's just been thinking about the stories a little bit differently, and helping to shed light on a broader perspective of the vaccine, less defensive and more sort of showing them the benefits of where we're going and why the recommendation changed.
And I think your reference to the Falcaro article from the UK that was discussed in one of the earlier sessions today really drives home that point. For 12 to 13-year-olds, it was nearly 100% protection against CIN3. So that's a pretty powerful story, and that coverage really waned over time. So I think that's a great point, is that we're learning more now that we're able to continue to follow the benefits and really dig in. So Bob, I want to come to you next. Tell us what populations may benefit more from starting at age 9.
Yeah, so I think, if people are able to start vaccinating at age 9, that's going to benefit everybody. And this is really something where, a rising tide is going to lift all boats, and it's going to improve our vaccine coverage. It's going to improve our level of protection. It's really going to get as many people protected as possible. But especially for people who may have issues with access to care, where it may be a little bit harder to get in, really taking advantage of every opportunity, starting as early as possible, and utilizing all of those healthcare visits, even before age 11, really increases our ability to get these kids protected, and to really, increase coverage more broadly. And especially as has been talked about before, when we start thinking about COVID and all of the disruptions to care, when kids are coming in and they're trying to catch up, there's a lot to do now at 11 and at 12. And the more that we can do earlier and try and just sort of spread out that burden, I think is going to really help everybody get our vaccine coverage up so much higher.
And we had a question also come through in the chat about how might starting at age 9 really help for parents and caregivers who have increasing levels of hesitancy. So what are your thoughts about that?
Yeah, I mean, I think that, as we think about vaccine hesitance, it's been mentioned before, concerns about sex, I think is one of the big ones that's come up around HPV, but being able to address that and we know that parents are more accepting of HPV vaccination if it's offered earlier, because they're just not thinking about their kids having sex when they're 9, relative to what we might see at 11 or 12, but also being able to do that first dose of HPV at 9, that second dose at 10, Tdap and meningitis at 11. Now you're giving a little bit more opportunity to have fewer shots, a little bit less concern about side effects. And I think that can help, address some of those concerns from the part of parents in terms of the number and types of vaccines that they're getting.
And earlier, both Margot and Janet alluded to this idea that at that 9-year-old visit, you may actually have a little more time to answer questions and do some more explaining to help build confidence in HPV vaccination. So we're going to now transition to a designated hitter. So it's my pleasure to bring in one of our National Roundtable's co-chairs, Dr. Rebecca Perkins, who is going to share with us some timely information related to this discussion as well. So welcome, Rebecca. So tell us, what evidence exists about the impact of starting HPV vaccination before other adolescent vaccines?
Thanks, Heather. So we're working right now on a study that we hope will be published soon. So this is late-breaking data. We use the market scan cohort, which is children who were privately insured. We looked at kids who were age 9 in 2015 who had continuous insurance coverage through the age of 13. So essentially, any vaccination they might have got would be captured in the database. And we use logistic regression to predict their odds of vaccine series completion, depending on whether they got their first HPV vaccine before their Tdap, with their Tdap on the same day, or afterwards. And we found that kids who started the HPV vaccine series before their Tdap had a 38% higher likelihood of getting done on time by 13. And those who started after their Tdap had a 30% less likely chance of finishing by 13. So actually some good evidence that starting before you do the other vaccines will actually increase your completion rates, which really speaks to the clinical experience that our speakers have been talking about, as well as what we've seen in some of the other trials, that starting early just leads to more kids getting done on time. It doesn't really seem to have any negative impact.
That sounds great. And it's a really timely to look at what the data show, right? So, hey, let's go check out the data, right? The data are going to tell us the story we're looking for here. And it seems like there's a lot of benefit based on the review of those data.
And this cohort with 100,000 kids from every state in the US.
So well represented. And then, Rebecca, was there any ability to look at across certain states or regions of the country? Did anything come through there?
So there were some other differences. So compared to the Northeast, kids were more likely to complete their vaccine series if they were in the West, and slightly less likely if they were in the South. They were more likely to complete their vaccine series if they saw a pediatrician compared to a family medicine physician. Sorry, Margot, it's clearly just that not everybody in your field is listening to you, because obviously all of your patients are totally done. And those were some of the main differences that we saw.
Margot, we know you're the cleanup hitter. Don't you worry. We know that. So I want to also try to touch on, we have a few minutes left, some questions in the chat. So this question is for Margot and Janet. One of the structural barriers we've been really exploring is related to a state IIS ability to forecast HPV vaccination at age 9. What have been your experiences with that resource?
So meaning whether or not it's going to flag you to know that it's due at 9 as opposed to due at 11?
Yeah, have you seen that in your state?
No, but we do have the opportunity to put it in, and it doesn't flag it as being too early, which was another problem that sometimes shows up when you're building a database and it has time frames that it's expecting things. So I don't know that we've been able to fix the forecasting part, but I do know that we can now enter it. There's a window that you can enter it in now, instead of just a wider window instead of a shorter one. So if you put it in at 9, it doesn't come up at 11 like you're due because you got it too early, which was a problem early on.
Ours does pop up on our EMR, so it does pop up as an opportunity or a care gap in our electronic medical record. The other things that we do is we do a lot of outreach, and even the week before, our assistants will call the parents for the 9 and 10-year-olds, telling them that they're due for a vaccine, because that way we avoid the parent will say, oh, I told them they weren't due for a vaccine today. So we avoid that so we can, still have that conversation and get them vaccinated.
Right. So that also reinforces the importance of from check-in to check-out, that everybody within a vaccination setting really plays an important role. So here's another question that came up in the chat is, so you, Margot, expressed, some initial reluctance and like, dang. So how can you get other providers on board? Like, what do you see as a strategy for providers who perhaps are resistant to this idea of starting before age 11?
I mean, for me, I think you have to start by letting them have their feelings. So similar to the parents who have a little bit of concern or hesitancy, I think you have to let the clinicians have a moment of frustration. So it is frustrating to have to go back, particularly if you're in a larger system, and negotiate getting your EMR updated. And it takes work and effort, and having to retrain your staff to learn how to say the right words in the right way. It's effort on their part. And so I think you have to acknowledge that and be honest about the fact that you do know that it's a change, but then you help by really helping them to understand why it's a benefit. And so really sharing with them how this is making a difference. And honestly, the information that Rebecca just shared, I think would make a huge difference in people. So this idea that not only am I going to give you a better response, but I'm more likely to get you finished and through the series. I think these are the kinds of things that you can tell people. So it doesn't become a battle about whether I'm doing the right or the wrong thing. And it becomes more, how can I make it easier for you to make this transition, which recognizes where they are, but also helps them get to where they're going.
That's great. And I also want to give Bob a shout out. He led the roundtable through the process of developing an evidence summary on starting at age 9 based on sort of what we know. So if you haven't yet seen that, please check that out. It's available through the National HPV Vaccination Roundtable website. And that also led us to, you heard Rebecca talk about this paper. Rebecca, tell us a little bit about where that paper will be available.
So we're actually developing a supplement on the evidence around starting the HPV vaccine series before age 9. So it will come out in Human Vaccines and Immunotherapeutics, and we should have about 15 articles with ranging from commentaries to data from NIS-Teen, other market scan, other sources on the impact of initiating vaccination before the age of 11. So look for that in the spring as the baseball season gets going.
Yeah, we're really excited about that. So Janet, I'm going to let you have the final question here. So tell us, like, what would you say to a fellow clinician if they were on the fence about starting to recommend HPV vaccination at age 9? What would you tell them?
Well, I think it's a culture, and it has to be the culture of the entire office, and you have to get, everybody on board and make sure that that they're starting at age 9, at least starting the conversation. And I think that's the hesitancy. I think, it's the hesitancy is, how do I approach this? How do I start this conversation? And always welcome those questions. And most parents, they want to know the information, and they want to hear from their provider because they trust them. And so if we can make a difference, as physicians, as nurse practitioners, advanced practitioners, if we can prevent cancer with a vaccine, go for it.
Exactly. And that is the last word. HPV vaccination is cancer prevention. And we have the chance to vaccinate kids today to protect them from those cancers in the future. Well, y'all, you hit it out of the park. And so I'm really delighted to have had the chance to moderate this session and engage you and with your expertise. So thank you very much. And I'm going to turn it back over to the next manager.